So it's really official. Meron pala talagang bagong TOS, guys. And the PRCBON calls that your enhanced tables of specifications. So guys, before we start discussing your enhanced TOS, I'm inviting you to the PRC's official website. So guys, punta ka sa prc.gov.ph because that's the official website of the PRC. So, para hindi ka alanganin sa mga information na nakikita mo online, you have to see for yourself kung saan galing ang announcement na to. So, when you go to prc.gov.ph, I'll be linking it down below. You go and click on the professional regulatory boards you find on the upper part of the website. So, when you click on that, you would see another parang box that says Professional Regulatory Boards. So when you click on that, lalabas lahat ng mga professions in the Philippines. So you click on nursing. And then you can see on this column here sa may menu column, meron dyan home, board composition, board law, history, etc. So you scroll down and then you look for the table of specifications. Guys, you click on that one and you would see two links dito. The first one is linked on the resolution number 10, series 2025, the adoption, issuance, and promulgation of the enhanced tables of specifications for the subjects in the nurse's licensure examination. So when you click on that, makikita mo yung official na resolution ng PRCBON mo that says about the enhanced TOS that you will be having on November 2025 so that I'm not gonna share any fake news, okay? So, accordingly, guys, no, as per verified, ang sabi, this PRCBON's announcement or the issuance of the enhanced table of specifications, yung contents ng board exam for November 2025 must adhere to what the enhanced table of specifications gives, okay, or lists. So, guys, ang nakalagay dito, this will be adopted for November 2025, which is your board exam this year, November 2025. And the good thing about this is that there is no ambiguity on the language of your PRCBON in this resolution because it clearly states that the enhanced TOS that is given out in the public available in the PRC website, in the official and only PRC website where you should base all the announcements for your board exam, guys. It says here that the enhanced TOS shall serve as the basis for the test questions that will be found in your board exam on November 2025. So, in my opinion, guys, this is a good thing because you have a guide for your board exam. And let me just say this, no, it pains me to see people who are selling this online para lang magkapera when in fact it's totally free on the website of the PRC. And well, in fact, this is literally public domain or ibig sabihin, guys, this is public information that everyone should have access to. In this video, I'm planning to make the summary. Inayos ko yung table na naka-annex dito, which is yung Annex A. And the Annex A of this resolution is the enhanced tables of specifications for the subjects in the nurse's licensure examination. So sa Annex A, guys, or this attachment to this resolution is your enhanced TOS. So I know medyo magulo siya tingnan. So what I did is that I tried and simplified the version of it so that I can help you for free. Guys, and again, you can freely access this on the official website of prc.gov.ph. It's literally there, and I don't know why some people are still selling this. It just pains my heart. It should be for free. Nursing students who want to take the board exam, they are already very anxious. Tapos you are preying on that. You're taking advantage on that by selling the enhanced TOS as a tracker. Guys, ewan ko na lang talaga. Saan nyo ba nakukuha ang lakas ng loob? And what's good about the enhanced TOS, guys, no, let me just get this out of my chest. Yung mga sinasabing mga huling bulong, mga huling pabilin, na lalabas daw sa board exam. Guys, ang masasabi ko lang, no, walang cheat code sa board exam. Literally, nilabas na ang enhanced TOS ng BON mo. So, yun na yung aaralin mo. Bakit ka pa mag-enroll sa ibang review center na may huling pabulong or magbabayad ng malaking pera para lang makapasa ng board exam when you have the resources around you? Help your kapwa nurses. Same-same lang kayo magbo-board exam. Wala nang bentahan dito guys, okay? Tulungan na 'to, tulungan. Lahat tayo magkakalisensya. So guys, ginawan ko 'to ng simplification so you can follow. And ang blueprint for your enhanced TOS is your Bloom's taxonomy. Yan yung in-emphasize ng BON dito. And guys, let me just simplify Bloom's taxonomy for you. According to Bloom's taxonomy, there's different levels of thinking. May hierarchy daw yan. So starts with the level 1 until you reach level 2, 3, 4, 5, and 6. So this hierarchy of thinking or way of thinking, guys, classified yan siya. Level 1 as the easiest cognitive domain, and then level 2, 3, 4, 5, and 6 being the highest part of the cognitive domain of a person who's learning. Okay? In your Bloom's taxonomy, you have level 1, and that's your remembering. So when you say remembering, it's your ability to recall objective concepts. So for example, it's your ability to recall that the heart is a muscle. And the level 2 of the domain of your Bloom's taxonomy is understanding. So this means that you know your information and you can explain it. You understand it, that's why you can speak about it. So you know that the heart is a muscle, for example. And since you know it's a muscle, you know it can contract. So yun yung form of understanding. And the level 3 of the domain is application or applying. Ibig sabihin guys, what you know, you can apply. So you know that the heart is made of muscle, and you understand that muscles contract. When the heart contracts, it needs to relax to rest. So the more the heart contracts, the more it can get tired. The more the heart can relax, the more it can rest. And the level 4 of the cognitive domain is the analysis part, your ability to analyze concepts. And this is essentially knowing that the parts of the heart sums up for a greater whole function of the heart. So you know the heart is a muscle, and you know that a muscle can contract. And when the muscle can contract, it should also relax so that it can produce better contraction. So in analyzing, guys, you know that for the heart to have better contractility, it should be able to relax. Dapat may sufficient rest time siya, or else the muscle will get tired. So this is where you can analyze concepts such as reducing cardiac workload. Okay, so yung mga ganun. And then the level 5 of the cognitive domain in your Bloom's taxonomy is the evaluation part, your ability to evaluate. So basically, guys, these are your 3 C's: your ability to criticize, your ability to compare, and your ability to contrast. So you can compare the heart of a younger child to an older adult. So comparatively, a younger child has better contractility as compared to an older adult kung saan worn out na yung muscle ng heart niya. And you can also compare a heart of a well-seasoned athlete versus the heart of an ordinary person, let alone yung heart ng sedentary lifestyle. You can also compare the heart of a full-grown woman as opposed to a full-grown man, and yung difference na meron sila. That is innate with their gender. So in here, you can evaluate and contrast that the heart of a woman has lesser risk of cardiac problems because of the presence of the hormone estrogen. And you know, estrogen has cardioprotective function as opposed to a man na walang estrogen. So they suffer heart problems 10 years younger versus women. Yung mga ganun, the ability to contrast and compare and criticize. And the last level, which is the highest part of the domain here, guys, of your Bloom's taxonomy is your level 6, which is the creation. You're able to create out of the thinking that you're doing. The last part is your ability to create out of all these thoughts that you have. So in simple terms, the last domain is all about your basically NCP mo, your nursing care plans. Kasi your nursing care plans is reflective of what your thoughts are, or yung mga contents mo, yung knowledge mo, yung idea mo about a specific concept in nursing, and you can apply that to a patient during patient care. Okay? So creation, the last domain of your Bloom's taxonomy is your NCP. Correct ba? So in my opinion, guys, no, the BON's choice of choosing Bloom's taxonomy as a cognitive domain to work on and premise the entire enhanced table of specifications is quite reasonable. Kasi nagfi-fit siya sa concepts ng nursing. And again, I know what you have in your mind. Is there something to be afraid about? Is there something to be anxious about? Your feelings are all valid. But again, guys, yung enhanced TOS mo, this is nothing to fear about. I know it's scary because it's new. I know it's scary because it's foreign to you. But it doesn't mean that it's scary, then you're gonna fail it. No. Just because it's new, it doesn't mean you'll fail. Just because it's something that you don't know, doesn't mean you have to restart from the start, from the top. Hindi yun ganun. This is essentially still the same thing that you read on your books. The concept will not change just because you have a new enhanced TOS, and the concepts will remain the same. Even if my Bloom's taxonomy na application, it will remain the same. It's scary and it's making you anxious because it's new and it's foreign, but you will still pass. You can do it. Just do your part. You read, you answer practice questions, you attend your classes. You're safe. You can do this. So, tingnan natin ngayon ang contents of your enhanced table specifications. And I'm simplifying it here as a simplified version. This is all for free. You can screenshot them on your screens, guys. Ilalabas ko yan dyan. So, kung makikita mo dito, guys, NP1. Let's start first with NP1, and that's your nursing practice 1. This is care of individuals, families, population groups, and community. So, basically, this is still your community health nursing concepts. But under here, guys, you can see there is specific parts labeled by your PRCBON. So there's part 1 and part 2, or part A and part B. In your part A, guys, it has the bigger chunk of the items. Kasi the total of the items here is literally 80 items, or 80 points, or 80%. Since 100 items man per NP ang meron ka. So, for NP1, Part A is 80 points. Dito, guys, ni-specify ng BON mo on the first column that the questions are premised on your ability to apply your knowledge. So, my remembering and my objective questions, and your ability to perform based on your answers on the question. So, this is application of knowledge, your analysis, your critical thinking, your ability to create. Okay, compare, contrast. So, ganun lang. Simplify lang natin. Your performance-based question, which is the bigger chunk of the 80 items, is your ability to critically think. Care of individuals and the use of your nursing process, your ad by. Meron kang care of clients with non-communicable diseases like may risk factors, prevention, and control for 10 points. Guys, if you have opened your YCHN book, guys, nandun yun. It's chapter 6, page 177. Andun, non-communicable diseases, prevention, and control. And under this, guys, you can find hypertension, your cerebrovascular accident or stroke, your cancer, and your diabetes mellitus, your COPD, your asthma. So, andun lang siya. That's for 10 items. And then the second one for the care of individuals is the care of clients with communicable diseases, control, eradication, and elimination of communicable diseases for 10 points. Ako lang ha, based on my feeling, guys, no, sa lahat ng nangyayari sa Philippines ngayon, baka may lumabas about leptospirosis. Kasi lagi tayong binabaha. And yung nangyari sa PGH, 'di ba? Napuno yung capacity nila. So, nilagay nila sa labas yung mga pasyente, okay? So, yun, baka lumabas yun, your leptospirosis, okay? Feeling ko lang naman, okay? And then, guys, the next part, number 2, is care of families. Kung saan gagamit ka pa rin ng ADPI, 10 points ang question for care of normal families. So, ito sa book na to, ito guys, ang basis dito sa family nursing mo, meron, if you have the book of Maglaya, you can review yung mga family nursing concepts niya doon. And then, care of families at risk, 10 points din. So that's a total of 20 points for family nursing. And then number 3, care of population groups. Still, you're using the nursing process add by. And you have 20 points for care of population groups with other health priorities. And then number 4, care of community, which is 20 points as well. So dito guys, sa care of community, this is your community health nursing, kung saan makikita mo yung Philippine Healthcare Delivery System, Department of Health, Universal Healthcare, and dito guys, SDG na ang meron. Wala nang Millennial Development Goals. It says here, Sustainable Development Goals, primary health care and primary care, your community assessment, community diagnosis, planning, intervention, evaluation, and then kasali din ang epidemiology, vital statistics, demography, care of community during disaster, school nursing, occupational health and safety nursing, community organizing, participatory action research, recording and reporting and information, technology, community setting, and the referral system. So basically guys, lahat to CHN mo pa rin. There's no need to panic. Just review your CHN question banks on your respective review centers or your own personal test banks kung meron ka dyan. And then the part B or the part 2, which is the remaining 20 items guys, ang nakalagay dito, application of the following. So yung may application about the evidence-based practice, about laws, legalities, ethical, moral principle, communications with the patient and with the interdisciplinary team in the healthcare, and then reporting and documentation, collaboration, management and leadership, techno-intelligent care system, and your nursing core values. So guys, kung titingnan mo ang part B na 20 items, it sounds like your Palmer J concepts. So, I think Palmer J concept appears on the part B. And guys, if this is true, then more or less 20 items na lang siya on your NP1. And then guys, on your NP2, Nursing Practice 2 naman, you have two parts here in NP2. Part 1 is care of mother, adolescent na well clients at risk or with problems, acute and chronic. So for the care of mother guys, yung mga nanay na gustong magbuntis, tapos nabuntis, then during pregnancy, and then during labor, and then after labor. Yun yung mga concept. So the same pa rin, correct? Yes, it's just that right now you have better structure. So guys, on the part 1, ang items mo dito will pertain to the application of knowledge, performance-based din siya on safety and the use of ADPI, evidence-based practice, communications with your patient and the interdisciplinary team, reporting and documentation, and collaborations. So itong 1 to 6 guys, these are the premise or yung foundation ng mga questions na lalabas for part 1. And yung mga questions under this premise, yung content nila will be about, the first one is normal maternal concepts, care of mother before birth, which will surmise about 8 points, 'di ba? 8 items lang pero sobrang daming nakalatag na mga specifics na dapat mong aralin. So do not read your books. Again, go on your test banks and then you go back and revisit your maternal questions. So the next one is care of mother during labor and birth. Guys, 8 items lang siya. 8 points lang total. So guys, ilan yung items? 8 items lang. Tapos maraming nakalatag. Again, review mo lang ang Q&As mo. And then another 8 points for care of mother following birth. Kayang-kaya mo to guys. Other concepts following birth, na-discuss nyo to for sure. Nasagutan mo rin to. Walang problema. There's nothing to be afraid of. Abnormal maternal concepts, meron ka dito. Kanina normal, ngayon naman mga abnormal maternal concepts. 8 points para sa care of mother with complications of childbearing. And you also have other concepts related to complications during antepartum, intrapartum, and postpartum. Then you have another 8 points for care of male and female with problems on reproductive health, about menstrual cycle, about your fertilization, guys. So guys, oras na para sumagot ng mga questions about fertility. And alternative to childbirth. So maybe in my mind, what is this alternative to childbirth? Is it like adoption or is it like guys yung mga surrogacy? Baka yun, okay? Di natin na alam. Baka nag-level up na ang mga questions when it comes to this. And then guys, next is about ethical, moral, and management of resources or staffing. Guys, basically 10 points yun. And I think ito, ethical, moral, tsaka management of resources and staffing, Oh, sounds like Palmer. Okay, sounds like Palmer. So 10 points of Palmer on the part 1 of your NP2. And then the part 2 of your NP2, guys, is ito na. Human growth and development, care of neonate, infant, toddler, preschool, school age, child, and adolescents, Noel clients, and care of at-risk neonate, infant, toddler, preschool, school age, sick child, and adolescent with alterations in health status, acute and chronic. So basically, there will be normal and abnormal pedia and growth and development concepts. Yun lang yun ang ibig sabihin. And then again, the questions will be premised on your application of knowledge, your ability to remember and recognize mga objective questions. Performance-based on your safety, nursing, and use of ADPI, and then evidence-based practice, communications with patients, and with other part of the team of the interdisciplinary team ng healthcare, reporting and documentation, and as well as collaboration and teamwork. So guys, ang topics under dito is human growth and development, guys. 10 points. And then, next is 15 items, guys. Care of neonate, infant, toddlers, preschool, school age, child, and adolescents na mga well clients. Kayang-kaya mo to, guys. Kayang-kaya mo to. And then the next part, 15 items or 15 points para sa mga abnormal growth and development mo. So, care of at-risk neonate, infant, toddler, preschool, school age, sick child, and adolescent with alterations in health status, acute and chronic. 15 points. Amazing. Alam na alam mo to lahat. Don't worry. And then, guys, 10 points for legalities, collaboration, and teamwork. So, sounds like your what? Your Palmer concepts. Okay? Hopefully, totoo to, no? Na 10 points na lang talaga siya for MP2. Bigger chunks yung nilagay for concepts na nursing-related talaga in practice. And then guys, for your NP3, it's still your med-surg concepts. But for NP3 guys, ang pangalan niya ngayon is Care of Clients with Problems in Surgery, Oxygenation, Fluid and Electrolytes, Infectious and Inflammatory, and Immune Responses, Cellular Aberrations, Acute and Chronic. So sa part A, again, may dalawang parts na naman to, part A and part B. In your part A, guys, meron ka dyang safe patient care competencies wherein it's premised under your application of knowledge and performance based on safety and the use of ADPI. Doon galing yung mga questions. So, ang topics under part A is the care of patients undergoing surgery, 10 points. Then, guys, perioperative nursing mo, may preoperative, intraoperative, and postoperative questions, 10 items, okay? And then, 20 items para sa mga problems in respiratory system mo to. So, care of patients with problems in oxygenation, kayang-kaya mo to. 20 items, respi concepts. And then, guys, fluid and electrolyte acid-base imbalances, 20 items. So, sa mga students ko na tinuruan ko sa endo, guys, alam nyo to, may technique tayo dito. So, don't forget. Kasi in-emphasize talaga dito, cellular dehydration as well as your sodium and potassium imbalances. So, kayang-kaya nyo to, guys. And then, 16 points para sa acid-base imbalances mo. Guys, may Q&A ako nito dito sa YouTube. You can watch it. So, acid-base imbalance is 16 points. And then, the next part of the topic is care of patient with infectious, inflammatory, and immunologic disorders. And then, number 5, meron ka din patients with cellular aberrations. Ibig sabihin, guys, cellular aberrations, cancer. This is your onco nursing. 14 points. And others. Ano man yung others na yan. And then the part B of your NP3 will be the application of your evidence-based practice, guys, as well as your nursing core values. So mapapansin mo dito, ang topics is about health education. 10 points siya. Kayang-kaya nyo to. And then, guys, 10 points for quality improvement. So that one sounds like Palmer. Sounds like Palmer. So hopefully, totoo to. QI mo is 10 points lang. And then guys, for NP4 is still your med-surg. Pero ang nakalagay dito, care of clients with problems in nutrition and gastrointestinal, metabolism, and endocrine. So, kayang-kaya to ng mga students ko sa endo. I'm pretty sure and I'm confident. Perception and coordination, acute and chronic. So, neuro din. So, sa part A, guys, ang sabi situational to. In your part A, the topics are nutrition and gastrointestinal concepts, 25 points. You should be able to apply your knowledge. So, dito yung remembering and objective. 5 points siya under gastro and nutrition, yung mga objective questions. And then the 20 items is about your performance based on safety and the use of your ADPI. And then letter B, yung next topic is metabolism and endocrine. 25 items, guys. Endocrine is your friend. Kayang-kaya nyo to. Application of knowledge dito, guys, 5 points lang, okay? And yung performance based on safety and use of ADPI, 20 points. Kayang-kaya to ng students ko. And then, next is perception and coordination, where the examinees can perform competencies focusing on providing care, safe quality care to clients with chronic and acute conditions. So dito, guys, again, 5 items lang ang application of knowledge or yung remembering or objective. And then 20 points for performance based about safety and use of ADPI. So guys, itong consequences of systemic diseases. Think about diabetes mellitus, how it affects the eyes. It causes your what? Diabetic retinopathy. Ganon. Okay? Yun ang ibig sabihin ng consequences of systemic diseases. And then, part B of your NP4. Part B is 20 items. 20 items, that sounds like Palmer. In my opinion, sounds like Palmer. Dito siya ilalabas. So, thank God, hindi na siya Nursing Palmer 3. It's already, or Nursing Palmer 4. It's already nursing practice. Okay? And then, guys, NP5, this one you expect psych questions as well as mga acute concepts in your medical surgical nursing. So, ang title ng NP5 mo is Care of Clients with Maladaptive Patterns of Behavior, Acute and Chronic. Care of Clients with Life-Threatening Condition, Acutely Ill, Multi-Organ Problems, High Acuity, and Emergency Situations. So, under here, meron ka na naman Part A and Part B. So, for your Part A, you have Safe Patient Care Competencies. And this is hinged upon your application of knowledge to remember and have objective questions. Sabi dito, guys, 20 points. Okay? So, my state of the mental health in the Philippines, 5 points. And then the next one is psychobiologic basis of behavior. And then C, dito guys, 5 points lang to siya. Therapeutic models and its relevance to the nursing practice. So, kasama na din dyan ang understanding stress. And then 10 points naman ang binigay for your psychopathologies. I have a Q&A on your psych and some of the concepts here, no, if not all, covered siya. So you can review on that. And then meron din guys performance-based wherein you have to practice safety and the use of ADPI. 30 items siya. 5 points given to assessment of the subjective and objective data. Another 5 points for your NANDA taxonomy or your diagnosis on DSM 4 and 5. So, ang ibig sabihin naman nito guys, sa NANDA taxonomy, nursing diagnosis, yung mga magagamit mo for psych patients na nursing diagnosis, alin yung priority mo dun? So, questions like that. And then, you don't really have to worry on DSM 4 and 5 kasi hindi man tayo psychometricians or psychologists. So, we really do not have to understand DSM at its core. But we just need to know what is the purpose of your DSM 5. Okay? And your DSM 4. So, basically, guys, itong DSM 5, that's your Diagnostic Statistical Manual of Mental Disorders. So, meron ng version 5 and version 4. Again, you don't need to worry so much about this kasi this is not the nurses' function talaga. We just need to know as nurses, ano bang function ng DSM 4 and 5 in our practice? Gaano ba siya ka-relevant? And then, you have 5 points for planning and implementation of care. And then, the Mental Health Gap Action Program or the MH Gap, 5 points. And then, 5 points for the treatment modalities na meron tayo guys like your somatic therapy, psychotherapies mo, behavioral therapies, cognitive therapies, your milieu or your therapeutic milieu, your art therapy, your dance or music therapy, your attitude therapies, your psychopharmacology, guys. So, 5 points for all the treatment therapies. Ang dami-daming nilagay, pero 5 lang ang kukunin. And then, evaluation of care, outcome-based naman to. Eto, I don't know what this is about. It just says evaluation of care. And then the next is still part of your part A, 30 items naman to guys on concepts on acute biologic crisis. The first one here is care of clients with altered ventilatory function. So meron akong concept on your rest by Q&A, I have that, as well as Q&A on your pneumothorax, chest tubes, I have that. So you can watch it here on YouTube. 5 points lang for that one, guys. And then, care of clients with altered tissue perfusion, 5 points lang. So, I think this dito lalabas yung mga cardio concept mo. So sad. 5 points lang for cardio na concepts. Yung cardio na MS talaga, guys. If you want to answer practice questions on arrhythmias kasi hindi ka masyadong confident, I have a general video on arrhythmias here on YouTube. And it's foundational. So you can watch that and then you try and apply kung ano yung natutunan mo sa video na yun when you answer practice questions on arrhythmias. And then tell me if it's effective. And then guys, 5 points siya dito for altered tissue perfusion. But if you look back on NP1, meron din nilagay din mga non-communicable diseases, care on non-communicable diseases. And kasama dun sa non-communicable diseases guys, hypertension, which is also a cardio concept. So baka dun ilabas yung about hypertension. And then 5 points for clients with altered elimination. And then another 5 points for clients with altered perception. And then guys, care of clients with multi-system problem, 5 points. And then you also have here care of clients with high acuity and emergency situation, medical emergencies, 5 points lang guys. So 5 items lang under all of those things. And then part 2 of your NP5 is about enhancing, empowering, and enabling concepts. 20 points, guys, on communications, reporting and documentation, collaboration and teamwork, as well as your techno-intelligent care systems. So, yun yung premise. And then the topics under the premise is your nurse-client communication, 5 points, guys. Teracom mo, Teracom, 5 points. And then documentation in psychiatric nursing practice, 5 points din. And then concepts on collaboration and teamwork, 5 points. As well as equipment used in acute or high acuity emergency cases, 5 points, guys. Like, yung bago ngayon, yung paggamit ng CPR machine. So, legit pala talaga na may evidence-based practice na sa new TOS. Meron na tayo nito sa mga hospitals, no? Even in our hospital, we already have this CPR machine. Kung saan hindi na ang nurse ang nagsi-CPR, kundi a machine. Don't panic and you just think, ano ba yung kailangan mong alam as an entry-level nurse para masagutan mo to? Okay? So, you don't really need to deep read anything. You look for practice questions about these things. Kasi for sure, meron yan sa books nyo. Guys, so basically, yun yung TOS mo, yung enhanced TOS mo now. And based sa mga nakasulat naman dito, guys, no, what's nice about this is that you have a blueprint on what to study about. And what's not nice about this is kabado ka kasi bago siya. But doesn't mean it's new, you'll fail. It doesn't mean na by bago ay babagsak ka na or that kulang na ang preparation mo. So again, trust on your preparation. You can do it. Kaya mo yan. So itong enhanced TOS mo, mas ano siya ngayon? Mas upfront siya ngayon. Mas direct to the point kung ilang points ang ibibigay sa mga respective na topics. And what's good about this is, hindi na siya Palmer-centered. And hopefully, no, hopefully, ganun talaga ang dating ngayon sa board exam. So, hopefully, sa board exam ninyo ay mafa-follow talaga ang enhanced tables of specifications. And you listen to me. Just because there's a new enhanced table of specification doesn't mean na insufficient na ang preparation mo and there's already more or less 2 months left for you to study for your board exam. It's not that. You are sufficient. Yung mga inaaral mo ngayon sa review centers mo, sufficient yan. You use your enhanced table of specifications as a guide. Don't use it as a source of anxiety or demotivation. Tandaan mo guys, ang kalaban mo dito is yung kaba. Kasi lahat ng kailangan mo para pumasa is binibigay sa'yo. Kasi binayaran mo yan at pinaghirapan. So you help yourself. Wala kang ibang kakampi dito kundi sarili mo. So whatever other people are saying, para hindi ka kabahan, double check and verify. So ito, meron nga talagang bagong TOS. So look for yourself, you can see it there. Sinabi ko sa'yo, mahahanap mo yan sa PRC website mismo. I know for some of you, it's already paralyzing you. No, like you don't know where to start anymore. You're just laying in bed. You cannot even open your iPad or phones or notebook kasi hindi mo na alam kung saan magsisimula. You have your TOS now. You choose a topic na hindi mo alam. You search online for practice questions. Yung mga nasa Quizlet, guys, galing yan sa mga NCLEX books, nilagay lang sa Quizlet. Kaya kung mapapansin mo, yung mga nakikita mo sa Quizlet is the same thing you see on your books. Oo, kasi hindi ko alam kung sino nagka-copy-paste dyan, pero thank God for their work. Kasi meron kang nakikita online. So, sagutan mo yun. Yun ang tingnan mo. Basahin mo ang rationale. But if you have your books, better. You read your books, you answer the practice questions related to the topics here na wala ka pang alam. You start from there. You start somewhere. You don't have to start from the top and then brush on everything again. You don't have to be perfect on your performance. You don't have to be perfect on your preparation. If you are aspiring for perfection, guys, that will not lead you anywhere. It's a good thing and it's actually an innocent thing to have, no? An innocent thought na you want to be perfect on the preparation that you want because you just want the best for yourself. I understand that. Gusto mo lang yung best para sa sarili mo. But remember this, guys, no? Aspiring for perfection is aspiring for the impossible. Making mistakes is the way of learning. And guys, if I may say, no, pounding perfection on yourself is quite unfair. Kasi sarili mo lang din ang kakampi mo sa board exam. So maawa ka naman sa sarili mo. Be your own friend. Be your own fan. So root for yourself. Beyond the wholesome discipline that you want for yourself because you want better and you want to pass the board exam, guys. Above all and everything that's happening right now, you have to be kind to yourself kasi sarili mo lang ang kakampi mo. Hindi pwedeng mag-collapse ka pagdating ng board exam because of all the pressure. So again, the pressure is good because it will keep you going. The pressure is good because ibig sabihin yan, you're aspiring for something that's bigger than yourself. But the good thing about this, guys, is that the results, you cannot control them. But what you can do to make the results better and more pleasing for you is to do what you have right now. Your actions, you can control them. The time you do your work, you can control them. The moment your inner voice starts telling you na ang bobo-bobo ko, I'm so insufficient, bakit hindi ko yan alam? Bakit hindi pa ako ready? Bakit alam nila ako hindi? These are all little poisons you're placing inside your brain and inside your core that will deteriorate who you are as a person. Remember, guys, positive self talk and positive self reinforcement is key to performing better. So, every time you want to do something, you affirm yourself, I can do this because I can do this. I am capable, I am smart, I am hardworking, I am diligent, I am disciplined. Positive self-talk lang. So relax, take a step back, pat your own shoulder, and say it with me, guys. You are capable, you are smart, you are hardworking, you are diligent, you are disciplined. You can do this. Just remember, the board exam, hindi patalinuhan yan. That's a competition kung sino ang pinaka-safe na nurse sa inyong lahat. Sino ang pinaka-pwedeng mag-practice in the bedside, outside with real patients. Because remember guys, you are applying for an entry-level nurse. You are not applying for specializations as a nurse. Entry-level tayong lahat. Okay? So, there's no need to aspire to read all the difficult topics or to answer all the most difficult questions in nursing. There's no need for that. What I would tell you is this. When you go in the board exam site, make sure that the glasses you have on you is common sense. Ang nasa frontal lobe mo dapat muna, common sense. Do not overthink, do not over-ratio. Kaya mo yan. That's all. Bye.